Hello everyone. In this class, we'll study about cardiac arrhythmias. The heart normally beats at a regular rhythm set by SA note. Any deviation from this normal rhythm is called as cardiac arrhythmia. When any irritable focus is capable of discharging repetitively at a rate more rapid than that of SA node, it can initiate and maintain heartbeat for several seconds to few hours. This is called as ectopic cardiac beat. If an irritable ectopic focus discharges once, the result is a beat that occurs before expected next normal beat and is transiently interrupts the cardiac rhythm. This results in atrial, nodal, or ventricular extrasystole or premature beat. If the focus discharges repetitively at a higher than the rate of SA node, it produces rapid regular tachycardia resulting atrial, ventricular or nodal paroxysmal tachycardia or atrial flutter. The cardiac arrhythmias are generally classified into atrial arrhythmias and ventricular arrhythmias. Atrial arrhythmias. If the excitation spreads from an independently discharging focus in the atria, it is called atrial arrhythmia. The impulses stimulate AV node prematurely and it is conducted to ventricles. Atrial arrhythmias are further classified into atrial tachycardia, flutter, and fibrillation. Atrial tachycardia. This occurs when atrial site, that is outside the SA node, becomes a dominant pacemaker. It is characterized by very regular rates ranging from 140 to 220 beats per minute. Atrial tachycardia may be caused by overindulgence in the caffeine, nicotine, or alcohol and may also occur during anxiety attack. It is not associated with block. Atrial flutter. If abnormal focus is in atria, it will lead to atrial flutter. Here the rate of impulse production is around 200 to 350 beats per minute. During atrial flutter, AV node is unable to transmit all the atrial impulses to ventricles. The maximum capacity to transmit impulse from atria to ventricle is 230 beats per minute, and therefore the ventricular rate may be half, one third, or one fourth of the atrial rates. This is associated with 2:1 or 3:1 heart block. In atrial flutter, QRS complex is normal. Atrial fibrillation. Atrial fibrillation is characterized by a totally irregular rapid rate that is around 300 to 500 beats per minute. In this, ventricular rate is completely irregular because only a fraction of atrial impulses that reach the AV node are transmitted to the ventricles. Ventricular arrhythmias. Ventricular arrhythmias are more serious, particularly ventricular tachycardia, because here the cardiac output is affected. The ventricular arrhythmias are further classified into ventricular tachycardia, ventricular flutter, and ventricular fibrillation. Ventricular tachycardia. It is caused by abnormal automaticity or by re-entry within diseased ventricular tissue. This most often occurs in patients with coronary artery disease or cardiomyopathy. Here, QRS complex is abnormal. It is broad and bizarre shaped. Ventricular flutter. If abnormal focus is in ventricle, it will lead to ventricular flutter. In ventricular flutter, the rate of ventricular contraction is between 200 to 350 beats per minute. ECG shows large oscillations, that is hairpin curves, where main and terminal deflections can be no longer to be detected. Ventricular fibrillation. Here the rate of ventricular contraction is about 300 to 500 beats per minute. It is a fatal condition because fibrillating ventricles cannot pump the blood effectively and circulation of the blood stops, causing sudden death. Causes of flutter and fibrillation. Flutters and fibrillation occur due to the defect in the conduction that permits a wave of excitation to propagate continuously within closed circuit, which is called a circus movement. This is referred as a circus or re-entry phenomenon, that is a formation of circuit around a ring of myocardial fibers by the excitation process. The common sites of occurrence of this phenomena are the tissues joining the opening of inferior and superior vena cava and around AV walls. There are two mechanisms of development of circus movements. One is depolarization of ring of cardiac muscle and retrograde conduction due to the transient block in the bundle of His. Depolarization of ring of cardiac muscle. Normally, the excitation impulse spreads in both directions in the ring, and the two impulses cancel when they meet on opposite side. If there is a transient block on one side due to the slowed conduction, the impulse reaching here earlier via shorter route will find this area refractory and die off. However, the impulse which goes around the ring and reaches here late finds this area no longer refractory. It will pass this area and continue to circle indefinitely, producing circus movement. Retrograde conduction due to the transient block in the bundle of His. The transient block due to the slowed conduction in parts of conduction pathway prevents anterograde conduction in the portion of bundle His, and then this area is invaded from below. This area above the block has had a time to recover and is no longer refractory, producing re-entry. That is a retrograde conduction causing atrial depolarization, resulting in atrial beat called as atrial echo beat. So this is how the circus movement is produced because of the transient blockage uh, of the myocardium, so which causes uh, the circus movement when the other impulses reaches it late, where it is no longer in refractory period, so that leads to the circus movement. Arrhythmias can also be broadly classified into bradyarrhythmias and tachyarrhythmias. In bradyarrhythmias, heart rate is reduced and it occurs in the following conditions. Like it can happen in sick sinus syndrome, where there is a failure of SA node and in heart block. Tachyarrhythmias are when heart rate is increased along with abnormal rhythm, and it is referred as tachyarrhythmias. The various tachyarrhythmias are atrial and ventricular ectopic beat, atrial and ventricular tachycardia, atrial and ventricular flutter, atrial and ventricular fibrillation. Paroxysmal tachycardia. If the tachycardia appears and declines abruptly, is called as paroxysmal tachycardia. The attack may last from seconds or minutes to many days. It may be having focus either in the atria, that is, which is going to lead to the paroxysmal atrial tachycardia, or in the ventricles, that is, they are going to lead to paroxysmal ventricular tachycardia. So these are the salient differences between atrial tachycardia, flutter, and fibrillation. The rate in atrial tachycardia is up to 220. In flutter, it is 200 to 350. In fibrillation, it is up to 500. Atrial contractions are normal uniform in atrial tachycardia. In flutter, there can be alternate large and small contraction due to the partial refractory state in atria. In fibrillation, there are irregular oscillation of the surface called fibrillation as length of the refractory period further increases. The atrial to ventricular rate is 1:1 in atrial tachycardia, whereas in flutter it can be 2:1, and in atrial fibrillation it can be 2 or 3:1 due to the irregular discharge from the AV node. ECG findings in atrial tachycardia, all the time intervals shorten. So there can be in atrial flutter there can be second degree heart block, and in atrial fibrillation there is absence of P wave and appearance of fibrillation waves, and you can see irregular QRS complexes, and there won't be T waves. Coming to the differences between the ventricular tachycardia, flutter, and fibrillation, the rate in tachycardia is around 220. In flutter, it is between 350 to 500, and in fibrillation, it goes up to 500 beats per minute. Whereas in ventricular tachycardia, the QRS complexes are polymorphic. In flutter, you can see hairpin curves where the main and the terminal deflection can no longer be differentiated. Whereas in fibrillation, the complexes they are irregular, fast, small potential fluctuation. Fibrillating ventricles cannot pump the blood effectively, and this can lead to sudden death. This is in brief about arrhythmias. Thank you.